Latest now on Pope Francis. Early this morning, Vatican officials announced that the 88-year-old had been stabilized after suffering 2 respiratory crises. Senior national correspondent Terry Moran is at the Vatican. Good morning, Terry.
Good morning, George. Vatican says today that the Pope slept well through the night and is resting today. This quiet morning comes after the Pope was struck yesterday by those 2 episodes of acute respiratory failure. That is a term that the Vatican has not used. Francis's oxygen levels plunged at that time due to a significant accumulation of mucus in his lungs. So doctors performed 2 bronchoscopies. They're inserting a tube down the Pope's throat in order to clear out that mucus from his lungs. The Vatican says the Pope remained conscious throughout and that he responded to that treatment. He has been able to resume some light respiratory physiotherapy to strengthen his lungs, and he is not on any kind of mechanical ventilation at this time. But Francis's doctors say his prognosis remains guarded. They are taking this one day at a time and have offered no indication of when the Pope might be able to leave the hospital. Guys.
All right, Terry. Thanks for you being there for us. Thank you. For more, let's bring in ABC News Chief Medical Correspondent Dr. Tara Narula. So we hear that the Pope's condition sounds like it is improving, but as Terry just reported, he had 2 episodes of respiratory failure. How commonly does that happen in the recovery of pneumonia?
We can definitely see that happen, and it is one of these situations that needs to be dealt with emergently. It can come on suddenly, and essentially it is a situation where the lungs are not able to exchange gases properly. So we have low oxygen in the blood, we have a buildup of carbon dioxide, sometimes, or waste product in the blood. And it can happen for a number of reasons. So pneumonia being one of them, heart failure, asthma, COPD, blood clots, and people can really decline. So their heart rate can go up, their respiratory rate can go up, they can get fatigue, lack of mental awareness or confusion. And so usually we treat it with different mechanisms of support. In this case, you heard they did a bronchoscopy to take out the secretions, which was one cause of his respiratory failure, and also what they said was bronchospasm, so tightening of those airways. And so with that non-invasive mechanical ventilation, you may think of something like a CPAP machine. We call it CPAP or BiPAP, where we push the air into the lungs to improve the flow. It usually is considered either a step towards or trying to stave off intubation, where we have to put a breathing tube down, or trying to avoid it, right? So it is that step right before someone might end up in the intensive care unit.
And we keep hearing acute respiratory failure. What exactly does that mean?
Yeah, so as I mentioned, that's really where the lungs can't exchange that gas properly, and that can be a very dangerous situation. I think the fact that, he has avoided intubation or ending up in the ICU, he's not on blood pressure supporting medicines, these are all encouraging signs. They've also said his white blood cells, the ones that fight infection, have remained stable, so it doesn't seem like there's a new infection. So certainly these things show us that there are signs of improvement. Now he's off the non-invasive mechanical ventilation. That's the latest we've heard, and he's just on supplemental oxygen. So, good signs, but a lot of this stop and go improvement and backtracking, and that sometimes happens in 88-year-olds in the hospital with pneumonia.
Right, and when doctors say the prognosis is guarded, that means?
I think that that's probably the right way to say that. That means we don't know, George, and I think we're going to have to see. I mean, clearly he had an aspiration event on Friday where, some of the vomit went in the lungs. That can be damaging sometimes to the lungs. We know he has a condition called bronchiectasis, which is a chronic inflammation in the airways where it's hard to get that mucus out. He had part of his lung removed. So the road is going to be tricky, I think, over the next few days. We'd like to see it get to the point where we're not seeing, him back and forth with the non-invasive mechanical ventilation and the oxygen, and really we're able to wean him off the oxygen and get him out of the hospital. We know the longer patients stay in the hospital, the more they're at risk for infections, blood clots, and other kinds of complications.